much, where AstraZeneca and Johnson vaccines are traditional technology, yet lower in efficacy in the clinical trials. So it brings up questions, can individuals choose which communities get which vaccines? Right out of the gate, some decisions were made that were seemingly based on technology components. For example, Pfizer requires -80 refrigeration, which kind of limits distribution to certain sites. And Janssen is a single dose vaccine, which might better certain populations in that they don't have to return for the second dose. But I think, decisions need to be made that are equitable, and communication is really a key component here. Communication needs to be transparent. And I'll just put a final sort of issue that I could think about is issues with the double dose vaccine. And so mandating the second dose is something that I've been thinking a lot about. I mean, some centers had to pivot on the fly when we first started delivering the Pfizer vaccine across Canada because they thawed the vaccine, and once thawed, they had no arms to put it in. And it's a tremendous waste of a limited resource if people do not show up for that second dose. So could there be policy that's made to mandate that individuals who have taken the first dose must show up for the second dose?
Would any of the panelists like to add to that response, pitch anything else in? No? Okay. Then I actually wanted to ask a question about that. So when you mentioned mandating that people to get a second dose, are you suggesting that there may be a fine put in place if you don't show up to your second vaccination appointment?
I mean, this is a kind of thing where I can't imagine that we could put such restrictions on something that would be health related. But if you think about it, if you showed up for the first dose and you don't come back for the second dose, you've taken away from a supply from someone else. And we know that the first dose alone is not sufficient to, convey immunity. So I think unless there's sort of a health reason or a reason that would allow somebody to get around taking the second dose, I think it's so important that we have something that addresses people taking the first dose and not the second.
Yeah. So Taras, I know you're an outspoken advocate for migrant workers. How much priority do you believe that should be placed on the vaccination of that demographic?
Well, thanks very much for the question. I'm honored to have had the ability to advocate for migrant workers, along with so many other organizations in Essex County, Ontario, and across the country, who try to represent a segment of our workforce that is underrepresented and doesn't have fully the same rights as other workers in the province. So, I will preface my remarks specifically to that question in that, as a politician without a background in immunology, virology, or any scientific background that would give me legitimacy in qualifying who gets a vaccine first or not, I say, and I would urge all governments to lean on very robust data from those professionals before making any political or policy decisions. So, there could be the temptation to politicize vaccination. We have seen it in other jurisdictions, and it's not supported by science. So my position as an elected official would be to urge politicians and decision makers to be guided by the science first and foremost. So as it relates to migrant workers specifically, the only reason that I think you're posing the question, in contrast to other segments or other groups of workers, is that the conditions in which migrant workers find themselves puts them at a greater risk. They are more vulnerable due to the nature of that work. They're brought to Canada from other jurisdictions. We know that their accommodations are really substandard. They are cohorting in large groups. Sometimes we've seen pictures. We know we have evidence of up to 30 or 40 migrant workers living in the same dorm room, where they call them bunkhouses. This is a an area that is ripe for transmission of any communicable disease. So, I think that's why we're that's why the question is being posed. The answer is we need to embark on a robust reform to the temporary foreign worker program to make sure that the standards are there so that we don't really have to ask this question. I mean, are we asking whether Chrysler workers, because we know there's a large group, should they all be vaccinated as a priority group because it's a large cohort? I don't think so, because we know that the standards and parameters within those workplaces are a lot better than in the greenhouse industry specifically. So there's a lot of work to be done, but we know that because of those conditions, we saw COVID numbers skyrocket early on in the pandemic, and we also know that it wasn't migrant workers bringing COVID into Canada. They were getting it as a result of their workplace conditions. So big, complicated issue. I know it's a little bit of a convoluted answer, but I hope it gives you some idea of what, how I think policymakers should be approaching it.
Yeah, for sure. Dr. McMurphy, if you would like to jump in here about what might be some of the ethical concerns that occur when you're determining who gets vaccination priority, because I think that's a big question here when you're talking about migrant workers or other groups of individuals. How do you determine that?
Yeah, thanks. It's a great question. So first of all, let me just take a look. Let me just talk about policy briefly, because when we look at policy, we don't just look at one aspect of policy. There are actually three aspects to policy. One is the policy plan, which is the language of the actual policy and the way in which the policy frames the issue. And then there's the appropriation for the implementation of the plan. In other words, it's the budget and resources that are placed towards being able to implement that policy. And the third one is the actual implementation of the policy. In other words, how the rubber hits the road, so to speak. And here's where the actual manifestation of the policy can be seen. So those three aspects are really important when we're looking at healthcare policy. So there are four main bioethics principles that we take into consideration whenever we're making ethical decisions around healthcare and prioritization. And those four ethical principles are autonomy, which means people are free to be able to choose to act in their own best interests, as well as they are also able to have freedom from, as it is, intrusion in making those kinds of decisions. Second, there's the beneficence issue, which is the issue of promoting good, promoting positive health outcomes. Non-maleficence, which is the reduction of harm and the prevention of negative healthcare outcomes. And justice, distributive justice as in equity and fairness, substantive justice as in human rights. Those four principles are the four ethical principles that we take into consideration when we're making these decisions. The trade-off is that those ethical principles can compete with each other. And you've seen that in the United States, where autonomy has been prioritized over the principle of reduction of harms, for example, where people have pushed back against mask mandates, where they've pushed back against social distancing, for example, and that's the prioritization of the principle of autonomy. Here, though, in Ontario, in December, the Ontario government came out with a set of principles for guiding vaccine prioritization, and they prioritized the minimization of risks and the maximization of benefits. So that's the policy plan. When we look at the policy implementation, then we begin to ask ourselves, so what are those risks that we need to think about in terms of prioritizing groups? So the risks are death, serious illness, hospitalization. And so in order to be able to reduce those risks, we then prioritize groups that are most vulnerable to those risks. That's where we got the long-term care residents, long-term care staff, healthcare workers that would be highly exposed to COVID-19, for example, and that's how we came up with that first group of people to be vaccinated. And then you move to the next group, which might be exposed or have an uncontrolled exposure to COVID-19, which means they cannot control their own exposure, or those people, for example, who might spread COVID-19. And that's where we get congregate housing, we get migrant workers, we get groups who may have uncontrolled exposure to COVID-19 and can't protect themselves because they don't have PPE, or they're in large groups, they can't take time off from work, for example. So that becomes the next set of prioritization in order to reduce the risks and to maximize the benefits. So I hope that helps answer that question.
Yeah, that was very, very informative. Really, like the breakdown of policy making huge. So Rocco, could you maybe explain a little bit? I know there's been some controversy about business executives and government officials and hospital executives being given the vaccine because of their importance in their essential positions. Could you possibly give a little bit of a perspective as to why it may be necessary to vaccinate these groups?
Well, first off, I would begin that none of them should be vaccinated before it is their time for their specific group. I quite frankly, there was the unfortunate comment by the premier the other day. I think there are opportunities where leaders can be used to assist with vaccine hesitancy. But short of that, I certainly wouldn't be putting, leaders of companies who are, healthy without pre-existing conditions, other things being given any advantage in the queue. The sad tragedy of all of this is that this discussion is as pointed as it is because of scarcity. I just note the fact that Ontario marked that we had just finished vaccinating 1 million arms since the beginning of this, when the US has hit close to 3 million a day. And you have a much different conversation. You have a much different conversation in Israel that now has 100.26 vaccinations per 100 people in the country. And yes, it's a smaller country, but they've already vaccinated in arms 3 times in absolute numbers what we have in Canada. So we have to be upping our game. A lot of these issues will be reduced significantly as the supply comes. And certainly we're seeing that beginning of the acceleration. To the point that Dr. Porter made, I absolutely agree. I hate to see waste. So I would expect to see systems that have people on waiting lists the way they're doing in every other country. So nothing is ever wasted. I mean, my parents who are in their 80s are on 2 lists. They're on the list for their appropriate time, but they also got to tick a box that said, if can you get to the vaccination site within 30 minutes and be put on that list? We have to up our game in terms of systems, and that's why the one area where I'd like to see more is actually a willingness on the part of PHUs to partner with the private sector to assist in all of this. Not all of them have been as open to it. Many have, and in fact, we're partnering with many public health units to assist in accelerating the rollout by using project management, by using systems, et cetera, because ultimately the best way to deal with these issues of scarcity is to accelerate the process so we have those debates fewer and fewer times during the day.
Yeah. So when we look at this issue and we look at now with variants popping up, how could we maybe adjust some of the current policies to account for challenges and extra wrenches that new variants are going to throw into our rollout? Dr. Porter, would you like to answer that?
Sadly on mute.
Oops, sorry, my dog was barking, so I thought I'd spare you all that. So one of the things that viruses do really well is for the science students on here is they mutate and evolve, right? We're pretty lucky that the SARS-CoV-2 virus actually mutates at a really slow rate. But we're seeing these emerging variants just as a result of simply this pace of the spread of this virus. But we know that there's different fields in science that are working together to monitor the variants that are emerging and to test the potential effects that they may have on immunity generated by the vaccine. And this is bringing multidisciplinary groups together. For example, right here in Windsor, we're using wastewater monitoring and DNA sequencing to look at the variants that could be hitting our own region. Current vaccines are made to recognize specific parts of the virus, and the approved vaccines in Canada are recognizing a region on the virus known as the spike protein. So we do know that, and just as a little bit of background, but some of the viruses or the variants that are emerging are seeing changes to that spike protein. So the UK B117 and the South African B1351 variants, for example, there was great worry, will our vaccines now not recognize and be as efficient to these variants? So my answer to the question is, I don't think it's going to affect the rollout. And that's because currently the Pfizer and Moderna vaccine at every level of testing, it's been suggested that there's no change to efficacy. The Johnson & Johnson and Novavax have shown decreased efficacy to the B1351 that currently is primarily coming from South Africa region. But still, declined efficacy is still better than nothing. So I think people are still moving forward with everything. I think our big pressure right now is to get vaccines in arms to reduce the number of variants that we're seeing emerging. Of course, for everything, even the wild type sort of vaccines, we don't know the long-term effects of duration of immunity. And certainly we don't know what the duration of immunity is going to be for the variants. So we just don't know this yet. From a policy perspective, I just want to say that I think the variant story really amplifies a message that we simply don't know what's going to hit us next. And that's not even just about COVID, right? We have to be able to rapidly respond to whatever that might be. I think it's right now really a great time to fight the urgency of returning back to normal, because quite frankly, normal did not suit us well when the pandemic hit. And I think it's a good time to use this time to make the necessary changes that we need to do to ensure that the government and policies that we have are flexible and innovative, that we can embrace a change, a shift, where knowledge generators like science can actually advise policy. So I like to hear what Terrace was saying, rather than the other way around. And quite frankly, that doesn't really happen. We have science tables that are sitting at various points, but there's a ton of policy that is really tying people down. COVID has shown us the importance of prioritizing essential aspects of our society and investing in them. We, quite frankly, have great scientists in Canada. We have the power to support our own population, but right now we're not doing that. This needs to be addressed and changed. Our economy and our society cannot go through another pandemic. Communication needs to be improved, dramatically improved. We've seen improvement throughout the course of COVID. And certainly the pandemic has shone a light on the weaknesses in the communication chain. I'm speaking specifically between research and science and the government, and then back to the public. But we see that happen at multiple levels, of course, with education and business as well. So from a science perspective, I think this has been a weakness for a long time. And I think we have a great chance right now to make a positive change and to make sure that we have lasting change that can support positive growth.
Yeah, thank you so much for that, Dr. Porter. So Dr. McMurphy, what are some of the ethical challenges that policymakers encounter when we're trying to create policies that preserve both public health and trust, but mitigate some of the economic damage that has been caused, and maybe rein in that urge to go back to normal when it's not prudent to do so?
Yeah, great. This is an excellent question because I love talking about trust. So I just want to break down what public trust actually is first. So trust is made up of three factors. So when you're in a trusting situation, you have to be vulnerable, and you have to be in a situation where you're reliant on either another person or an institution for an outcome for which you are uncertain. In other words, you need to take a risk. If there's no risk and there's no vulnerability, then there's no need for trust. So trust is this kind of precious thing that we ask of people when they're in vulnerable situations. So when we talk about individual trust or public trust, I think we should actually turn this paradigm on its head and talk about trustworthiness instead. So how do these institutions, or how do policymakers demonstrate trustworthiness to the public in order to say, here's why we are worthy of your trust? So in that case, the three components of trustworthiness are competence and ability, beneficence, or acting in the goodwill or in the best interests of society, and integrity, which is being reliable and being transparent. And so we've already talked about a bit of the transparent communication that's necessary. Well, that's part of building that trustworthiness. And I think we can see that the public will comply with the government's requests when they see that the government is acting in a trustworthy way, or that policymakers are acting in a trustworthy way. So in other words, when they say, this is why we are asking you to engage in wearing masks, for example, or social distancing, and they give them the science that says, here's the information that we're relying on to make this decision. So there's a sense of competence and ability built into that message. The second one is the beneficence. We're doing this on the best interests of society. We acknowledge that there are damages, and here's how we're going to address those damages. So in other words, we have beneficence and we have goodwill in front and foremost in that discussion in asking for public trust. And then finally, there's integrity, being very transparent in communication, transparent in the messaging when we have to change our minds or we have to change policy, because this variant and these that might be coming in the future, as Dr. Porter talked about, as well as decisions we've had to make around policy as the pandemic rolled out and we began to learn new things about the pandemic. When we've had to change our minds or change policy, being transparent about why, being transparent about the science, and saying to the public, this is why we're asking you to do what we're asking you to do, build that sense of trustworthiness rather than asking for public trust. So it sounds a bit paradoxical, but you'll get public trust by focusing on trustworthiness.
Yeah, that makes a lot of sense. So Rocco, when considering the possibility of a slowed, or actually maybe not a slowed vaccine rollout, what does this mean for Ontario's already struggling economy?
Well, it's horrible, obviously. I mean, this is, we've lost tens of thousands of businesses already. We will lose tens of thousands more before this is done, and hundreds of thousands of businesses have added incredible amounts of debt that are going to make, that are going to constrain their future. Governments have added significant debt that will constrain choices in the future. So there is no more important job than the rapid and successful vaccination to so-called herd levels of immunity. But I do want to underscore that the variants also underscore both the science and an ethical issue, because the ethical template that Dr. McMurphy laid out, so incredibly appropriate, is currently only discussed within our borders. But the reality is that if you were to put that framework on a global basis, and what the variants tell us is that so long as there is the disease anywhere in the world, it has the opportunity to mutate. As bad as we're off, like we're 42nd in the world in terms of per capita vaccination, there are enormous swaths of Africa where there are zero vaccinations. And so and within wealthy countries like ours, we actually have an ability, as difficult as the circumstances have been, to have lockdown and to be paying people and minimizing. There are conversations I'm having with colleagues in other parts of the world who say, Rocco, lockdown is a luxury of the rich. You know, if you're in Brazil, you know that the right health advice is to stay home. But if you don't have refrigerators, if you have to buy your food every day, if you have to go out to put food on the table on a daily basis, you don't have that choice. So if the ethics is who has to get it first because of the consequences to them, you know, we're not playing the same global role that we as Canadians pride ourselves in, unfortunately. And we're also participating in our own form of vaccine nationalism.
Yeah, for sure. That makes sense, especially when you think about Canada's purchasing of Novavax, and there's some blurriness
and then
there.
we're the only G7 who've said we're going to draw on that. But part of that goes back to a point that that Dr. Porter was raising, because it's not just about the role that science can play. We're going to be making decisions, and its consequences for the economy. We're going to be making decisions around actually having future capacity to manufacture vaccines, which we lost years ago because we decided that we were going to focus on taking cost out of the system, moving preferentially to generics, which fine, takes cost out of the system, but leaves you in a situation where you are very vulnerable. And it's very difficult for any government on earth. I mean, I don't blame anyone. If you've got the factory producing vaccines and you've got your voters, your public screaming at you, saying, you get it in my arms first before it goes anywhere else, there are some things that you're simply going to have to make decisions on that are going to have to be part of the domestic economy. The days of just in time on everything is going to convert to some things where it's just in case. And you're going to pay an insurance premium in order to be able to produce PPE, vaccines in your own country to deal with these on a future basis, because this won't be the last.
For sure. So Taras, maybe you want to jump in here. So as the recently named jobs and economic recovery critic, how do you kind of play into this and in creating the policy development for the vaccine distribution? And also, how can we continue to make policies that protect and promote the recovery of Ontario businesses, but also stay ethical and partnering and not hoarding vaccines and being fair to all groups of people?
Thank you. Well, I think it ties into all of the other questions under this category. I truly believe that the COVID-19 pandemic will inform policy at all levels of government for the next generation. And if it doesn't, then we have missed an enormous opportunity to further society, not only our own, but those of our neighbors and our global partners, but also to remedy some of the injustices and imbalances and inequities that existed pre-pandemic that could have and should have acted as the type of insurance policy that Rocco mentioned. I mean, deep and sustained investments in public health could have positioned us better to do contact tracing and testing. Those investments in stockpiles of PPE that we learned early on were destroyed and never replaced. That at the time might be a difficult political sell, but in hindsight, my goodness, that's pennies on the dollar given what we've lost economically. So a lot of it will be in retrospect in terms of policy development. A lot of it will be looking at other jurisdictions and best practices and talking to groups like Rocco, but also talking to folks in academia. I mean, it has to be all encompassing, but with a focus on ultimately making sure that we never get here again. Because if we are as industrious as we suppose ourselves to be, and we know we can, we have the abilities, then policy initiatives have to reflect the desire to have that. But Suzanne, you called it, that's a new term for me, but it's not benevolence, it is
beneficence.
Beneficence. I mean, it's a great word. It should be the hallmark of policy because it pays dividends economically, societally, in health metrics, everything. I mean, from the minutia, I wouldn't call it minutia, but paid sick days. We know that has a tangible outcome on viral or reducing viral transmission. We know that the inequities built into to women in the workplace who have by and large been hit a lot harder than men. That has to be addressed. Something like ensuring that there's national childcare at an affordable price. These are things that tie into, go figure, pandemic response and preparedness. And that in and of itself, I mean, I could go on and on about our lack of resources into emergency preparedness. We had not reformed, and still to this day, have not reformed our emergency preparedness plan in Ontario since 2014. We didn't learn the lessons of SARS, and shame on us. But now, I mean, again, we are where we are. Let's ensure, and I think we will have political runway. Politicians of all stripes will have the political runway to say, we learned these lessons. They're going to take investments. We're all going to have to come together, but they will pay dividends, and they will be a fraction of the costs to do it, as opposed to not doing it.
So being proactive can save us many millions and much pain in the long run. And it seems that our policy needs to start reflecting a more proactive approach rather than a retroactive approach, as we saw in this pandemic. So moving on to our next topic of early lessons learned, which we've kind of covered a lot of throughout this discussion, but I'd like to open this question to all of our panelists to answer. And I'd throw it out to you first, Rocco, but generally, do you feel that your expertise in your field is being respected and incorporated into policy? And what are some areas for improvement when it comes to this COVID-19 vaccination policy?
Well, here, because we've been down on a whole bunch of people and how things are going out, I would like to start on a very positive note. And that is governments are built by design to go slowly. That's why you have official opposition. That's why you have committees. That's why you have commissions and reports. And COVID had basically said, that ain't good enough. You have to move far faster in order to deal with the problems. And to give kudos really to all levels of government and all political stripes, the level of collaboration and cooperation has been unprecedented. And it really has been an incredible example of a willingness to take your best shot at policy and then be able and willing to iterate, to listen and change. And it's not perfect, and hindsight is 2020 and all of that. But to those people who say, well, of course, Rocco, when the house is on fire, everybody reaches for the buckets and tries to put it out. The bottom line is we saw for virtually an entire year south of the border that is not necessarily the case. So I do think that level of cooperation and collaboration is something that we need to build on going forward, because the challenges that we will face, even as we come out of this pandemic, and we will be enormous around setting ourselves up for future growth, around dealing with unprecedented levels of debt. I mean, we haven't seen this amount of government debt since the Second World War. And so choices will be constrained, cooperation will be required, and we need to learn from those lessons and that collaboration that's happened.
Yeah, Dr. McMurphy, do you want to jump in next?
Yeah, thanks. I think one of the issues was raised by Taras was this whole idea of pandemic preparedness. And when I talked about those three aspects of policy, one of the second aspects was appropriation. It's really easy to develop prevention policy. It's hard to spend money and appropriate money to prevent something, because it's really hard to see an outcome. It's hard in a prevention policy to say, well, we prevented something from occurring, right? So I think focusing on appropriations for prevention policy becomes really important for pandemic preparedness moving into the future. And then I also agree with Rocco Rossi, is that we are a global society. And I think one of the things that the pandemic has shown us is that we are all interconnected, and the way in which things move through a global society. And it's true, many of us, even the conversations that I've been having with my research ethics colleagues at the World Health Organization, the things we've been having up at the University of Toronto, is that we were privileged to be able to create an ethics framework that we could implement and ask people to trust us and follow that particular set of ethics frameworks as we rolled it out. And there are many places in the world that don't have that privilege. And so how do we, as a wealthy nation, protect our global society neighbors, as we have been able to have the privilege to be able to roll it out ourselves? So I also want to say, I think we've done an amazing job. I think particularly in Windsor, Essex, we've done an amazing job with this pandemic. It's been hard, it's been difficult, but I think our government leaders have really done a really good job. I think our public health workers have done a great job. And so I think we should be very, if one can say, we should be very appreciative of the work that they've done, and the kinds of things, the lessons we're learning about the the disparities in society, the disparities in access to healthcare, the kind of geographic and racial discrimination that occurred. Like those are the things which we should take away and then start building policy around.
For sure. Accounting for different communities and marginalized communities seems to be a theme in our discussions today. Taras, would you like to add on to that?
Okay, yeah, yeah, along the same lines. Early on in the pandemic, and I think that's what the basis of the question is, what are the things that we have learned, early on or since the pandemic? And I was struck by the thought that, and I raised it in the House, that we are, as a society, only as safe as the most vulnerable among us. And I think that's kind of what got me into politics to begin with, if I think about it, to identify to identify policies that protect the most marginalized in society, and to understand the systemic connection that we have, whether it be through policy or through culture or community, to each other. So how does it work? How does it not work? And how do we gain the political will to address them? Definitely doesn't help to be trying to do it in the midst of a pandemic. But now that we're here, I am filled with some optimism that there is going to be a sharper focus on those groups and those policies. Again, with a whole lot more good faith from all levels, but all ideologies, that those that are focused on top-down economics or bottom-up societal and social issues can meet by focusing on those who need the help the most, because it certainly, by not doing that, we know that it's jeopardized all of us.
Yeah, so really meeting everyone coming together is important. We need to have collaboration to create robust policies. And I like to throw it back to Dr. Porter. If you would like to quickly kind of wrap up or add anything else you feel like hasn't been discussed yet.
Yeah, I mean, I think all my panelists have really said amazing things. And, I think that phrase, "in it together," that we've been saying throughout the pandemic, cannot be just a phrase used for the pandemic anymore. It has to be something that we continue to grow and to build on. And I also think, just as a sort of wrapping up point, I think, I've always felt that it's so important for just regular citizens to understand policy. And it's very important for science students to understand policy. We've never had a focus in science really on policy. And in many ways, scientists, we're happy to sit in our labs and do our thing. But I'm so happy that this group is formed and that you're showing the leadership to move this forward. Honestly, in science, as scientists, we're trained to take action in situations like this. It is what we do, and for someone like me to see that the communities are struggling to do screening when I have 5 PCR machines in my lab. I'm an expert at PCR, yet nobody is tapping into these resources. And as scientists, we're saying, well, we got to stay at home and sit back. No. This is not the time for us to sit back. And it's not the time for people to not recognize that we have many levels of, support that could have been tapped into and should have been tapped into. And I think as science students, I applaud you for putting this together, and I hope that you continue to build on it. And really, I think we need to be training our students to be proactive and to push the limits and to say, what we're here for. So yeah, I think
For
that's
sure.
my final thoughts.
Completely agree with you. And we for sure hope to continue to host more events like this and have more discussions and build up our students, empower them, educate, and engage everyone to have this, to bridge this gap that currently exists. But I'd like to now open the floor for questions. Nico has been manning the chat this whole time. Hit us with it, Nico.
All right, I'd like to say thank you to all of our participants for asking all the questions. We got a lot, so unfortunately, I don't think we'll be able to go through all of them. But just to start off, we have a question from Mackenzie for Taras and Dr. Porter. How do you increase public trust through education about the vaccines and their effectiveness? Because she said that she hears from people that they don't think the vaccines are guaranteed to prevent infection and they may not be necessary. What are your thoughts?
Did you want me to?
Uh,
You can start.
how do I do that? I share as many articles from Dr. Porter as I can on my social media because she is respected. We know that her voice and her knowledge and her advice is one of genuine evidence and trust. So that's where I rely on. Again, nobody calls my office in Essex to tell me they're having a great day. We get calls from people who are anxious, who are on the brink, who are really looking for support and help. And our best course of action is to point them to experts because we're not. So we're sort of Sherpas along the road. And I think coming from experts and relying on them and knowing and trusting them is our best course of action.
Yeah, and I was going to say that I think, again, for scientists, we're not trained innately, usually, to be outspoken in society and to use things like social media and, to speak in lay language to the public. And I think that's something, at the university, we've been trying to really work on and change, because we need scientists who can speak to everybody in the public and can point them in the right direction. Without that voice, if we don't get on social media and we say, oh, Facebook, that's not for scientists, we only publish in literature, the public is not reading literature. And so in the absence of that voice, they're listening to videos that are complete garbage. So, we need to be there, and you need to be directing. And our science students, I encourage you to be doing this. Tell your parents and tell your neighbors about the source of really good information, because they need to hear this. Yeah.
All right, Nico, next question. If we could limit our answers to 1 minute for these, that would be good, so we can get through all the questions we have in the chat.
All right, so our next question is for Dr. McMurphy. We have, since implementation plan is a part of policymaking, as you touched on, can you shed some light on Canada's plan for faster implementation with the whole vaccine rollout now that we're getting an increase in the supply?
Yeah, so part of what the next move of implementation would be is, how do you engage the communities in moving into places where the vaccines can be best accessed? So for example, you need to go out into geographic rural areas. The whole discussion we had about how do we actually get to the 80-year-olds that may be in the community? How do you roll that out? Using known suppliers, using the drugstores because they're used to giving flu shots, like finding places where people can access it. The more vaccines we have and the better access we have, and the way we roll that out is what's really important. So finding ways that people can get access as well as we can push out access is part of that implementation plan.
Thank you. Nico, next question.
So I'm kind of going to group a lot of these together because I got about like 4 or 5 different questions for Rocco on just like the whole entire business aspect. People are just asking in general, like, what are your thoughts with the whole closures with small businesses while big box stores can remain open? And also, like, what is the policy plan that goes into supporting these citizens that can't really do anything besides claim their government benefits, right? And they're getting these long-term consequences of shutting down their businesses.
Really great, great question and great series of questions. A couple of things. One, I go back to a point that Dr. Porter made earlier around asymptomatic testing. One of the problems we've faced from the get-go is we've not been doing enough testing. We've not been doing enough tracking and tracing, to the point where in highly dense, in the large urban centers, we're only tracking and tracing about half the cases. It's hard to build surgical lockdown when you don't have 100% data. So you go to the blunt instrument, and there is nothing fair about lockdown. So and intuitively, and we're not scientists, but my members, particularly small members, say, how is it safer from a public health to have hundreds of people in a lineup at a big box versus me, who knows every single one of my local customers and can bring them in one at a time or two at a time? How is that more dangerous for public health? But again, public health officials are doing the best they can with the data that they have, which is incomplete. If there's one thing I could ask all of you to do, if you've not downloaded the COVID Alert app on your phone, please do it. Please ask every single one in your network to do it. People say to me, Rocco, it's too much, I give up my privacy to the government. Yet I see people give far more information on Facebook, LinkedIn, Twitter, et cetera, Clubhouse, et cetera, and not one of those applications is going to save a life. This will help our frontline healthcare workers and will help us get better tracking and tracing, better containment. That's what we need to do, is we need to manage this crisis, not be reacting to it all the time. And buy local, because it can't just be about governments cutting checks. No business goes into business wanting to survive on government checks. They go into business because they're proud of their products and services and of their people, and they want you to buy their things. So you buy local or you say goodbye to local. That's just the fact.
Yeah, that's actually a really good saying. I like that. Buy local or say goodbye to local. Nico, you want next question?
So we have a question for Taras again. After enduring the pandemic and seeing its overwhelming impact on our hospitals and hospital staff, how important do you think it is for Windsor specifically to start building a new hospital? And if so, like, has your opinion changed at all throughout the course of the pandemic? Oh, you're muted.
Thanks, Nico. Hey, before we begin, I know we're winding down. I wanted to say how honored I am to join this call with Rocco and Suzanne and Lisa and yourselves. It's really an honor to join and to spend some time talking about it. So the pandemic has reinforced my support for a new modern hospital in Windsor and Essex County to serve not only Windsor and Essex County. In fact, I think the technology embedded into the plan for the new hospital could have positioned us probably better, given the construct of it and its ability to isolate patients. The testing that it will be built into, the testing capacity that will be built into that new hospital, as I understand it, would have given us an advantage early on had it been online. So again, we're thinking about what could have been, but now we should think about what should be. And I'm certainly an advocate for that new hospital. I think that it will position us well going in the future, and complementing the research going on at the University of Windsor to enhance the programming at the University of Windsor, so that there's a pathway to maintaining healthcare professionals and doctors who are graduating from the University of Windsor, maintaining a footprint in our community too as well.
Okay. Yeah, I do think we need to develop some more programs and continue to host discussions like this. But I think we're going to wrap that up at this point and close the question and answer session. I would like to thank all of our panelists for joining us today. It was a pleasure having you, and I think this discussion was really, really informative. I know I learned a lot of things. I'm sure all of our audience members also had a few good takeaways. I'm so thrilled to see the amount of support we've received for this first event, and I really hope that we can have more events like this in the future. If anyone would like to stay on to continue discussing, and if any of the panelists want to stay back at all to field a few more questions, it's completely up to you, 100% optional, but it is almost 5 o'clock. So I did just want to wrap this up now and let everyone know that if you want to leave, you're more than free to leave. But if you do have more questions, feel free to stick around for a few more minutes to discuss. Thank you.